everyone, I'm back with another video regarding NCLEX Next Generation NCLEX. So in this video, I will be sharing with you all what all changes are coming to the NCLEX RN exam and what are the differences and what will be the similarities that will be remaining in the exam. So for the similarities, CAT element of the exam is going to be same. CAT stands for Computer Adaptive Testing. In my previous video, I have explained in detail what CAT means, so you can refer to that. And basically it means that your response will be the category for the next question, like how difficult your next question will depend upon the response that you give for your present question. So that's how that element will remain same from the NCLEX, from the previous NCLEX, and the testing time is also remaining same, that is 5 hours. And then the next thing, that the research segment which was started by NCSBN is also going to remain same. So the research segment, there are about 15 questions that are given at the end of the exam after the computer has stopped your exam. But those questions will be numbered in a continuation, but they will not be scored. Those are the responses that you give for those questions will not be considered for scoring. So the next thing is the current questions that you already get in the old NCLEX will be seen in the next generation NCLEX. I would like to mention one thing here, that 80% of the exam, the next generation exam, like all the NCLEX exams after April 1, will be 80% will be the same, it will be similar, and 20% only, about 20% will be the next generation questions, will I be discussing in detail. So you don't have to worry about the changes that are coming, because the exam is totally going to change from 2023 to 2026. So this is a period of 3 years in which the exam will be changing, but it's not going to be changing altogether. So now let's talk about the differences that are going to be seen in next generation NCLEX. First of all, partial scoring is being introduced in this new generation NCLEX exam. So partial scoring is a great gift for the new test takers, because it will allow you to achieve more marks even if some of your answers or options are incorrect. So there are 3 types of partial scoring. I will be explaining briefly here, and also with some of the questions that I will be showing you. In those, I will try to explain as simply as possible. So the first type is plus and minus. So for a response that you do correct, you will get a plus marks in suppose say in a SATA question, and if you select a wrong answer, so you will be given a negative for that answer. So the result will be like total, like plus and minus, +2, -1. Then for that question you will get +1 and scoring. But there is no negative scoring, so the minimum will be 0. And then there is 1 and 0, like you did answer right, so you will get number 1 score, and if you did it wrong, you will get 0. And then there is rational scoring. Those will be explained in the question, but like rational scoring, there will be 2 blanks. If you selected option 1 for a particular blank, then in the second blank you have to select the right answer, like it should make sense, one in all, then only you will get the marks for those. So this is like briefly I will this is how brief I can explain about partial scoring. So the next thing is the lab values may be provided, maybe because sometimes they will tell you the particular number, or sometimes they will just say potassium of the patient is elevated or potassium is decreased. So the thing to consider is that you need to know what that elevation or decreasing in the lab value does to the patient and does to the treatment that we are giving to the patient. You don't have to worry about memorizing the lab values anymore, but you will have to know how to critically think about the lab values affecting your patient and how to act so that you can save your patient in time. So this is one difference from the lab in terms of lab values in the next generation NCLEX. So the next thing that we all are worried about are the case studies. Case studies are a major part because they were never included in the NCLEX exams. So for the case studies, I will tell you there will be minimum of 3 case studies, and each of them will have 6 questions, 6 items. And so total of, if you are getting minimum number of questions, so you will be getting about 18 questions from case studies, and along with 4 or 5 the next type of questions. 4 or 5, these 5 new types of questions, I will be explaining them shortly. And if you're getting minimum number and if you're getting maximum number of questions, so we can provide like 1 or 2 case studies will be increased, and you can get some optional like some questions from the research segment of the next generation type. So that's the thing. And one more thing I would like to mention here is that minimum and maximum number of questions for the exam. So the minimum number is 85 and the maximum is 150. So here 85 to 150. We can reduce the 15 questions because those 15 questions are the part of research segment and they will not be included in your scoring. So minimum will become 70 to 135 for the NCLEX RN exam. Now I will explain in detail about the new type of elements, new type of questions that are being introduced for the first time by the NCSBN in the next generation NCLEX. So now let's talk about the new type of items that have been included in the next generation NCLEX. So here is the first type, that is drop down close. So this means like they will be filling the blanks, but instead of just one word, you have to select a phrase from the arrows. So as you can see, there is you have to read on this side the medical treatment, and then in the blank you will be given more than one option, like there will be 2 or 3 options, and from those you have to select which one you think is going to complete the phrase, complete the paragraph. So this is 1 or 0 or 1 scoring. For example, in the first blank you did it right, so you will get 1 mark, and the second blank, if you did it right again, you will get one added mark, and in the third one, if you did wrong, so you will get 0 marks. So the total scoring for this will be 2. Okay, so now the next type is extended drag and drop. It's kind of similar to the old drag and drops, but it's extended. It means like for example, in this question they have given the risk factors that comprises of all, like modified and non-modified. So on this side they are asking about the modifiable risk factors. So all the drag and drop options won't be included in this. Previously all the drag and drop options were included. Like for say you have to tell how a procedure is being performed. So you will previously you had to include all the options, but now in the modifiable risk factors only some of the options will be included, and you have to know which are those options. And again it is 0 and 1 kind of scoring for these type of questions. Now the next are multiple response. It's similar to SATA, but they are numbered. As you can see in the question, only you have been given like what 5 interventions are most appropriate. So it's kind of a positive thing, like you don't have to guess how many options you have to select. You should like you know you have to select 5, and reading the orders and reading the question, it becomes easier to select the right options for the student. So this also goes on with the 0 and 1 scoring pattern. Now the next is multiple response grouping. In this thing there will be particular groups. As you can see there in the findings, you can see there are 3 groups they have made, and those groups have 3 options. So one group will have 3 options, and you have to see what are the right options. This type of question is going to have plus and minus scoring. It means if you give a answer, that is, if you give a wrong answer, so you will be given -1, and the marking will be depending upon all the answers that you gave. So the next is highlight text. I have explained this in my previous video very clearly. You can go check through it if you want to, and but this is like you have to highlight the text. You have to read the question, and then you have to see which text is going to be included in the answer. Like there will be certain text that can be marked, that will be the options, but you don't have to include all in the options. Sometimes they will tell you like you have to, like in the example I have done in the previous video with the U world, they have given you have to particularly pick on 6 things, 6 priorities to follow up. So you can go and have a look. It's really well explained and it will really help you guys. So now the next is matrix multiple choice. In this there will be rows and arrows, and you have to make a choice between 2 options. Like the nursing intervention, like you have to read the question very nicely, very clearly, and after reading the question you have to know, like you have to make a choice between 2 options here, because that's why it's matrix. It's called matrix multiple choice, and according to that you will be scored like it's 0 and 1 scoring. And then we have the matrix multiple responses. So in matrix multiple responses, you have to select more than one response in a particular row. Like shortness of breath, it can be in either 1 or 2, more than that. So you have to read and select the options according to that. So like in the previous one in choice, there was only, you have to select between 2 options like indicated or not indicated, but here in the multiple responses you will have to select between 3 or more than that. Like in a chart you will be given the options, and in this also the scoring pattern is plus or minus. So one thing you have to note that there is no negative scoring. Like even if you did all wrong, you won't be getting like -5 or -6 in like overall. In a particular question only, the plus and minus will be applicable. Okay, now this is a different kind of scoring pattern. This is rational scoring. As you can see, in this, two drop boxes are available. If you select a particular option, like I will tell you, like the patient is at high risk of developing hemorrhagic stroke as evident by confirmed CT scan. So if you select these two options, then only you will be getting a plus score. But if you select like something else like hyperglycemia and then confirmed by CT scan, so you won't be getting, even if your other answer is right, you won't be getting any score. One thing I would like to mention here, like knowing these scorings and knowing these type of questions like that are new to the NCLEX are an important part, but not as important as the content. You should really focus on the content, because if you know your content, you will be able to answer any type of question, even if something comes out of these five types. The main thing you need to do with the next generation is desensitize yourself with the types of questions that you will get. Like 20% of the questions will be uh, that are not seen, so you have to desensitize yourself, like using UWorld or Archers. From there you can get some practice questions, so you have to get familiar with them and not be anxious while giving the exam. Anxiety is a main thing while giving your exam. So if you focus on your content and know what changes are coming in the NCLEX, it will really give you a detailed, it will really give you a rational thinking and critical mind while giving your exam. That's all for today, and I will be sharing more content like this. So please subscribe to the channel, and I will be helping you guys to go and helping you guys with passing the exam.